My name is Philip and I am a registered nurse. I have worked in outpatient GI procedures for about a year now. I wanted to make this video to provide information about the colonoscopy procedure and what to expect when it's time for you to get yours done. All of the information that I provide in this video is from my experience and perspective as a registered nurse working in this specialty for a year now. Also, at the time that I post this video, which will be in March, just spreading it out there that March is Colon Cancer Awareness Month. So what better way to raise awareness than making a video about colonoscopies, which is the screening method for colon cancer. Okay, so let's get started. What is a colonoscopy? Okay, let's get the boring, snoozy definition out of the way. That way we can go to the more fun parts. So I'm gonna cheat a little bit. I'm gonna use Google. That way you have the proper definition of a colonoscopy. So according to Google, colonoscopy is a medical procedure involving the endoscopic examination of the large bowel and the distal portion of the small bowel. Yeah, that totally made sense. But I will explain it to you a little bit better and then different terminology, so hopefully it makes sense to you. So keep watching. So screening requirements, let's go over this. For anybody who does not have a family history of colon cancer, the starting age for this procedure is going to be 45 years old. If you do have a family history of colon cancer, you are going to have a younger starting age, and that's going to be starting at the age of 40. Now, this isn't a one and done procedure. It's just the starting age is going to be 45 if you don't have any family history of colon cancer, and the starting age is 40 if you have family history of colon cancer. You are going to be getting colonoscopies for the rest of your life from then on out, until like maybe the age 80, and then that's when it's kind of like, okay, you don't have to do this anymore. The preparation for this procedure, your preparation process is going to vary from person to person, and this is just because it all depends on whatever your GI doctor wants to prescribe you. The concept is all the same for all, different types of treatment, and that is you are going to be pooping a lot. And I'm not even kidding, a lot. The reason why is because we want your colon to be nice and clean so we can see the inside. If it's not nice and clean, we are not going to be able to see anything except your poop. And because of that, we are going to have to end the procedure early, have you reschedule, and then we are going to have you redo the whole prep thing that everybody loves. So please, just for the sake of your time and so you don't have to go through the prep again and have to do it all over and reschedule, follow the instructions that were provided either by the nurse or the facility, whatever, word per word. That way you do not have to do that again. What to expect when you arrive. So after you check in, one of the nurses will call you back to the pre-operation area. We call it the PreOp area, and basically here is we get you ready for the procedure. We will ask you a bunch of questions, and it's gonna get real personal. I kind of drafted up 6 main questions that we ask our patients. The first one is, if you are female, we do like to ask if you are pregnant. This is because we generally don't like to put anyone who is pregnant under anesthesia. If you are a female, then we will either one, ask you to sign a pregnancy waiver form saying that you're not pregnant, or 2, we could do a pregnancy test right there and then to confirm it. Second question is, we like to know when you last ate or drank anything. And this is super important, not just for any colonoscopy that you get done, but just for any procedures that require anesthesia. Because if you eat or drink anything within several hours of your procedure, the contents of whatever you consumed is going to be in your stomach. When you get anesthesia, it is going to slow how fast the food or water moves through your stomach and the rest of the intestines. If you have food in your stomach and then you get anesthesia, that food is not going to go anywhere. It's going to stay in your stomach. In addition, because it's staying in your stomach, you're laying down flat, it puts you more at risk for aspirated, which is just another fancy medical way of saying throwing up. And when you throw up, there is a chance that the food or whatever comes out from your stomach has a chance to go into your airway, and it can go into your lungs. If this happens, things can go south really quickly. Your oxygen can go down. This can lead to pneumonia, which is a lung infection. It could require us to intubate you so we could support your lungs and give it oxygen. So to avoid all of that, just make sure that you do not eat or drink anything. At least we recommend to our patients at least 8 hours before your procedure. Especially don't eat anything, because if you eat something 8 hours before your procedure, most likely we're gonna see it when we stick the scope up there, which means that you're not gonna be clean. So especially for this procedure, do not eat at all. The third question is, we like to know how your last bowel movement looked. This kind of gives us an idea of how clean your bowel is. Like, for example, if you say that your last bowel movement has like chunks coming out and it's solid, there is a high chance that your colon isn't clean enough for the procedure. But if you say, you know, it's liquid, no chunks coming out, then there's a higher chance that your colon is clean enough for the procedure. If you do have like little sediments coming out, as long as they're not like chunk, that's a-okay. And it doesn't matter what color the liquid is. It could be yellow, it could be green, it could be, you know, clear. It just all depends on what your treatment is for the preparation. Like, I've had patients drink, they were prescribed like a yellow colored drink and they were pooping out yellow liquid, so that's okay. Fourth thing we like to know is whether you are diabetic. We want to make sure that your blood sugar isn't too low when heading into the procedure, because if your blood sugar is low and then we give you anesthesia, this is not a good combination. This can lead to too many undesirable consequences. I will not list them because it just goes on and on and on, and it's a little bit more complicated than what this video was intended for. But just, if you are diabetic, let your nurse know, because we are going to check your sugar before and after the procedure. Fifth thing is, we like to know if you are allergic to any medication. This is so we don't give you this medication. Sixth thing, we will ask about your medical history. That way we can just have expectations about your course of treatment and if we need to look out for anything in particular. We are gonna ask for your credit card, your social security number, and your bank account routing numbers. Just kidding. Just, if anyone asks for that information, you better get the heck out of that facility, because they're not just doing a colonoscopy on you. They're robbing you. So after we ask all these questions, we will then ask for you to go ahead and change. We are gonna ask that you take all your clothes off. We do need you naked. Again, the scope is going up the butt, so no underwear, no bra. It's just you and the gown that we ask you to wear. After that, we will go ahead and have you sit on the gurney or the bed. We will hook you up to the monitor. We are going to check your vital signs. So this is your blood pressure, your heart rate, your respiratory rate, your oxygen. We're gonna take a look at your heart rhythm. And after all that is done, we are going to go ahead and start your IV. We do this for two main reasons. The first one is to get you hydrated again. When you do come in for your procedure, you are dehydrated because, you know, everything that you drank just went straight through you. And second thing is that we use the IV to give you the anesthesia. And then third thing, I mean, hopefully we never ever need this, but it's just in case of emergencies. After that, the anesthesiologist and the doctor will come and talk to you before we take you into the procedure. What happens during the procedure? As soon as we get you into the room, the nurse or the anesthesiologist is going to hook you up to the machine, and we are going to do another set of vital signs. So we're going to check your blood pressure, heart rate, oxygen, respiratory rate, your heart rhythm again, just to make sure that nothing's changed and we just have a baseline before we start the procedure. Next, we will do what we call a timeout. So timeout is where we mention your name, your medical record number, your birthday, just to make sure that we have the right person, the right patient in the room. After that, you will then be asked to turn onto your side, so either your right or left side, and we're gonna be like in a fetal position like this on the bed. After we get you into the proper position and we get you comfortable, good night. So we use the scope and we go all the way to the cecum, and we will briefly take a look at your terminal ileum, which is the ending of your small intestines. Cecum would be the beginning of your colon. After we reach the terminal ileum or we reach the cecum, we then start taking the scope out. On the way in and on the way out, we are looking for polyps. Anytime we find a polyp, we will remove it and we will send that sample to the pathology lab for biopsies. The way we remove it, the first time I saw this, it reminds me of like one of those toys where you like squeeze it and then the mouth goes like this every time you squeeze it. So just pretend like this is your polyp, and then this is the lining of your colon, this is a polyp, so it's like a little bump. What that little claw thing does, it grabs onto the polyp like this, and then we just yank it out. So as soon as the scope is almost out, the anesthesia will stop being administered. We mainly use propofol as the anesthesia drug, and sometimes, depending on the situation, the anesthesiologist will give fentanyl or Versed. The reason why we mainly use propofol is because it is great for procedures like this. It will sedate you enough where you won't remember or feel anything, but it's not a deep enough sedation where we need to stick a tube down your throat to help you breathe. You will be able to breathe on your own. So think of it as like a slumber. And as soon as we stop administering it, you start to wake up. Okay, what happens in recovery? When the procedure is over, the nurse and the anesthesiologist will take you to the recovery bay, and that is when they meet the recovery nurse. They go ahead and give a report to the recovery nurse. The recovery nurse then hooks you up to the monitors again, and as you probably guessed it, checks your vital signs. And we are going to monitor two main things. We are going to monitor your blood pressure, because one of the side effects of the anesthesia medication is that it could drop your blood pressure. Second thing is we are monitoring your airway. You are asleep and you are relaxed, so that could compromise this airway here. If it's super relaxed, your airway can kind of, relax a little bit, almost like snoring. When you're sleeping and you're relaxed, snoring happens when your airway, kind of collapses a little bit, and it causes that vibration, so we make sure that your airway stays open, because we want to make sure that your body is getting enough oxygen and your lungs are getting enough oxygen. It's very, very critical, especially if you've gotten anesthesia. It's very individualized on how fast you will wake up. Some people wake up, some people are already awake when they come out of the procedure. Some people take, 20 minutes, 30 minutes to wake up. It's all very individualized. During this time, I am constantly checking your blood pressure, all your vital signs, and if I see anything concerning, or you tell me that you start feeling a little weird, nauseous, if you feel lightheaded, dizzy, any of that pain, I will go to the anesthesiologist and present them the case, and then we try and treat you right there and then. I will say though, it is very common to feel nauseous, dizzy, and lightheaded. So if you feel any of those, or any unusual symptoms, do let the nurse know. That way we can try and manage it and treat it before we let you go. For the most part though, patients are ready to get up and dressed after about 30 minutes of arriving into the recovery. I personally don't let my patients change until they tell me that they feel safe enough to change. This is because if patients, if we push patients to change before they even feel ready, it puts them at greater risk for falling, especially if they got an anesthesia. Don't want you falling. There's a lot of consequences that can come from falling, so we don't want you falling. If the nurse is pushing you to get out of the bed and you don't feel ready, you tell them that you don't feel ready, because at the end of the day, your safety is the most important thing. So after you go ahead and get changed, sometime during the recovery, you will meet with the doctor, and then the doctor will go over the results of your procedure with you. So what to do after your procedure. So we give this to all our patients, but this is just kind of like a general instructions for what to do that day. I'll take a picture of it on my phone and then like put the PDF of it in the description below if you want to like take a look at it. But we'll go over it a little, just very briefly. So for the rest of the day, we recommend no driving at all. This is because the anesthesia can cloud your judgment, and we just don't want you to get into a car accident. You may feel like you can drive later on in the day, the evening, but even then, don't. The second thing is no alcohol. No drinking alcohol the day of your procedure. If you like to stay awake and you like to breathe, make sure you don't drink alcohol. Save the booze for tomorrow. Third thing, no strenuous activity, no working out. If you want to do a small walk later in the day or in the evening, that is a-okay, but just, see how you're feeling at the time. Don't do anything more strenuous than a walk. Save that for tomorrow. And then last thing, a lot of patients laugh about this, but it's serious. No important decision making. So no signing like legal documents, no getting divorced, no contracts, no working. Take it easy the rest of the day. It's your excuse to not do anything. The row below, these are common side effects of anesthesia. So like I mentioned, it is dizziness, lightheadedness, and sleepiness. Sleepiness is very, very common for the rest of the day. Again, it's going to vary person to person. Some people are like wide awake and they're ready to tackle the day after they leave. Some patients, they are like knocked out, sleepy, foggy, groggy for the rest of the day. Take it easy. If you feel sleepy, take a nap. And then dizziness, lightheadedness, not so much from the anesthesia. Usually that's from the dehydration. Even though we try to hydrate you at the facility with the IV fluids that are going through your IV, it's still not enough to replace what you lost. You are still at a deficit. So if you are experiencing dizziness or lightheadedness, just hydrate well for the rest of the day. It's gonna help with that. Now, when you're hydrating, just don't go overboard, because too much of anything is a bad thing, but just be mindful a little bit more about your hydration status that day. And then the 4 things that we tell our patients to look out for: bleeding, signs of infection, if you feel nauseous, you feel like you need to throw up, or any kind of like unusual pain that develops. It doesn't specifically have to be like in the stomach or in the butt. It could just be any unusual pain. Those are kind of like red flags. Depending on the severity of the symptoms that you are having. If it's super severe, we recommend just go straight to the nearest emergency department. But if your symptoms are a little bit more on the milder side, then we provide our patients, a number to call. But wherever you are, just go ahead and call whatever number they provide you, and just talk to the doctor or nurse and just kind of like explain what you're feeling and what symptoms you're having and all of that. And that's it. Starting the next day after your procedure, you can go ahead and go back to your normal lifestyle. And so you can, drink alcohol, you can drive, you can work out, just don't do all three of them together. Diet. So as soon as you leave, you're more than welcome to eat whatever you'd like. We do recommend to our patients though to start something easy on the stomach, just because your stomach has been through a lot with the preparation and not eating. So start off with something easily digestible, toast, soup, oatmeal, something like that. And then as the day goes on, you can slowly work your way back to whatever you normally eat. If you do drink coffee, you're more than welcome to drink coffee as soon as you leave. I know, whenever I tell patients that, they get like so freaking excited. I mean, I get it. So I hope this video answers any questions or concerns you may have regarding colonoscopies. I can assure you though, it is a lot less nerve-wracking than it seems. I always get, patients, and this is their first procedure in their life, and they're like super nervous, they don't know what to expect. And then I would get them in recovery, or I would see them on the way out when they're done with their procedure, and then they would tell me that, oh, like that was the easiest thing I've ever done. Or they tell me that they just had the greatest nap of their life and they want to come back again. So I can assure you, just from what patients tell me, that it is going to be a-okay. The process is very seamless. If you have any questions or concerns that weren't addressed in the video, please feel free to leave a comment below and I will try and get back to you as soon as I can. Otherwise, final message, make sure you get your colonoscopy. It is all about preventative care here on this channel and prioritizing your health. If you like health videos, feel free to subscribe. As always, there's no better time to invest into your health than right now. See ya.